Hi, Evie. Love your podcast. I have a question for Dr. TJ. I am wondering if he supports and believes in hormone replacement pellets. Some doctors do, and some doctors don't. And if you could discuss possibly the advantages or disadvantages of using a pellet. I'm 62. I've been on bioidentical hormone replacement therapy for quite some time after a hysterectomy. And currently I'm using the cream that I get at a compounding pharmacy. But honestly, it's kind of a pain because, I forget to use it. I run out before I get the next shipment. It's becoming pricey, etc. So I was just wondering if perhaps you could discuss the advantages, disadvantages of using a pellet or other options. And is it safe for us to use indefinitely? And also, if you think it's necessary for a woman to take progesterone if she has had a hysterectomy. I really look forward to your input, and I love listening to you. Thank you.
This one is a hormone-related question.
Okay.
Is it optimal to use a pellet for hormones versus cream?
Well, that's a very good question. And
it's a little deeper than that, but I want to start there because this is kind of layers.
Sure. So ultimately, it depends. It depends on a lot of different factors. It depends on, how healthy the person is, how old the person is, how large the person is. When we're talking about hormone creams, we have patients on creams in our office. We have patients that are on pellets in our office. And it really, truly depends on what that unique individual's system has going on. So sometimes creams work best because a person may be older, their levels are extremely low, and they just want a little bit of help. And so that's where creams come in perfect. Other times, creams can be a bridge to get someone's hormone levels up to then utilize a pellet. And other times, people just benefit going straight into a pellet, depending on their particular situation.
You just said something that I don't even understand is what would be the bridge? What would be the necessity of a bridge between getting someone's levels up enough before they were ready for a pellet?
So it can be either we're watching out for them with other health things that they have going on, and we're just wanting to make sure that we don't have any complications with other things here. And sometimes it's a mental thing with the patient. Like they're not really sure that hormones are going to help them. They understand what we're telling them, that their hormone levels are super low and they need some help, but they're not necessarily interested in going all the way to having a pellet put in where they can't just stop today if they wanted to.
Got it.
They've got to deal with it.
About that. Yeah.
So, they may not be quite there, and frankly, they may never get there. We have patients that are like, I'm not so sure that that's where I want to go, but I'm definitely interested in this. So our job is to meet people where they are and help them on their journey. My job is not to put them, and our job is not to put them on our journey for them.
Right.
They have to be on their own, and I think that separates us from a lot of healthcare practitioners in all walks of healthcare. Is we're helping the person on their journey. We're not telling them you have to do this, you've got to, that doesn't sit well with a lot of individuals. And I think that's one of the things that has helped us is our willingness to work with our patients, not putting them into a certain box and then telling them that they have to do something. I don't like it that way.
Yeah, because I think that a lot of people feel highly pressured when they go to the doctor.
And petrified.
And
a
nervous,
different P word.
Right? And then they feel overwhelmed because people are saying a lot of words they don't understand, speaking a language that they don't speak, and then it's like, okay, and they're kind of in this, for lack of a better word, kind of an inferior position intellectually in the room, even though it's their body and their healthcare, which I think is probably even more so now, given the last couple of years, right? With just so many conflicting narratives in what people should be doing with their health and what's been going on in the world. Yeah, I like that.
Yeah. And it's, unfortunately, it's really not that difficult to explain whatever a person has going on. Just takes an extra couple of minutes. Yeah. You know, it's just, they're just not getting that type of care.
No, because most people are not involved in a system that is set up for actual lengthy patient interaction.
Correct.
Right. It's
the system is
line.
Yep. The system is shorter visits, and so if you have a follow-up question or a follow-up 2 questions, those can't get answered because you just they don't have time for that, and it's no fault of the patient. It's just the system is set up not really in their favor to ask and answer a bunch of questions. And you have some doctors out there that do a very good job of that, right. But those are also the people that are, you know, at the end of the day, they're behind by an hour because you just can't keep up. Right. You just can't, unfortunately. That's why it depends on the person.
Okay, so then let me break that down even further. Is there a difference? Is one preferable over another depending on the type of hormone? Like, do you give pellets for a lot of different kinds of hormones? Like, I mean, I get testosterone pellets.
Yep.
Right.
So there's testosterone and estrogen.
Okay.
Those are your typical pellets.
Okay.
Beyond that, I mean, progesterone is usually oil or oral, not oil. Progesterone in oil is given as an injection for people going through fertility. But progesterone is usually an oral.
Which I take too.
Yeah.
Sublingual.
Correct. Mm-hmm. And then testosterone can be either a pellet or a cream. Estrogen can be either a pellet or a cream. And it's estradiol that's given as a pellet and a cream, really. Now, you can get estrone, estradiol, estriol. Like, it gets deep quickly with what you're giving a person. And it really, really depends. For the vast majority of people, it's just estradiol or testosterone.
So then one last piece of this was part of this question, is whether or not women post-hysterectomy, this gal is 62. Mm-hmm. We'll play a recording when we air this episode, and whether or not post-62, post-hysterectomy, whether or not a person like that even needs to be taking progesterone. Now, you can't answer specifically for her.
Right.
I get it, but
I can't answer specifically for her, but it just depends. So it depends on if someone is doing a testosterone and estrogen hormone replacement and they have symptoms of progesterone deficiency, yeah, they could take progesterone. Depends on what's going on. It really, truly depends. Progesterone helps with mood. It can help with sleep. It really depends on the person, and it depends on the practitioner understanding what this particular person's unique situation and circumstances are of whether or not they need it. Are we giving them progesterone, or would you be giving them progesterone to promote the ability for gestation? No, of course not. They had a hysterectomy. Like, that's not what it would be given for. It would be given because their natural production of whatever they would be making on their own, if they still had all of their parts, you would be complementing that. So you would be replacing what they would naturally be producing. Got it. Even though they may not be. Women go through menopause at different ages. I mean, you can't actually say that she might be in menopause if left up to her own natural devices, that she may not quite be in menopause at 62. It's extremely rare that someone is not in menopause at 62, but it is possible.
Just like on the other end of the spectrum, right, where some women go through menopause
and in their 30s,
abnormally early.
Yeah.
Like, I have a sister who, she went through menopause. She's 8 years older than me, and I think she's been through menopause for 15 years.
Right.
My mom was the exact same way.
Right.
Late 30s actually went through menopause.
Yep. It happens. It happens on both ends of the spectrum. And, I don't really know if we know why that happens early or way later for some versus the others. I mean, I have my guesses, exposures and toxic levels and, various things that go on, what you were exposed to in utero, what mama went through. Like, there's all different kinds of things.
So I said that was kind of the end piece of that, but I want to actually explore it a little bit further on the progesterone thing, because I have a story to share with you. And it was like, I just had seen a lot of different people over the time that I had my gym, right? It was like working individually with people. It was like, you could see a lot of what I would refer to as kind of like haphazard hormone prescribing going on, right? So I want to know your thoughts on that, for one, like where I always try to get you to like, you can see your face. You're like, stop asking me to throw professionals under the bus. I'm really not asking you to do that.
That's exactly what she's asking me to do.
I just see, how would I put it? Okay, I would expect that kind of in the typical Western world of medicine, for really deep knowledge on hormones would be somewhat limited, right? It's just not really what they're doing from a functional approach.
Correct.
Okay?
From a functional approach, that would be accurate.
Right. Versus like a treatment-based
Correct
approach to it. Fair?
Yep.
Okay. But I'm also now seeing in the naturopathic world where I've seen it. I would call them like the victims of it, of people that are going through, say, a weekend or week-long course on hormones, and then all of a sudden we got everybody just prescribing people hormones.
Are you asking for my thoughts?
Yeah.
So how to dance around this one?
It was just you and I talking.
That's a very difficult question to answer, because, again, this is one of those situations where I commend the person for trying to go get more information and learn a better way to help their patients. But also, this is kind of a classic example of hammer and nail. They learn something new and they're a hammer, and now everything they see is a nail, rather than gathering all of the information that may be necessary.
Oh, I love that. That was beautifully done.
That's what I see, right? Like,
yep.
Like we've all been victim of that. I've been a victim of that. Like, I'm like, and I luckily now I've got enough people around me to say, "Hey, TJ, you're kind of being a hammer here." And I was like, "Oh yeah, okay." And then you step back and you just reevaluate everything. It's very common. We go off to learn new things and we get all amped up about that, and we don't necessarily think about how do we incorporate that into our practice, rather than for like a few days we turn our practice into that.
Yeah, totally. Well, because you're excited about the new knowledge.
Right.
I get it.
Right. And so I can't fault them for that. And what'll happen with a lot of that, or what I hope to see happen with a lot of that, is that they dial that back and, they see, okay, well, this person didn't respond to that. If you can start learning with, okay, well, this person didn't respond to that, I need to shift gears a little bit. Now, how do I shift gears? Like, they may not have learned how to shift gears. Like, that's the sort of stuff where you're just hoping that they're going to evolve and go to the next level and the next level and the next level. Like, that's...
You're more hopeful than I am. I'm just saying, I would see it frequently.
Yeah.
I don't live in the same community as you do either, right? So it's totally different community. But like, here was the story I wanted to share with you. Gal who had successfully lost 40 pounds doing a keto diet.
Oh, yeah.
2 kids. I think probably at that time she would have been mid to late 50s. Came to see me. We put her on the InBody scanner so we can actually really see what's going on as far as her body composition is concerned. And yes, she had lost 40 pounds, which was awesome. But now she had completely just, her weight loss came to a screeching halt. And her body fat percentage was 48%. Okay, well, that's a problem, right? And then we dug into it deeper, and it's like she's using a topical hormone cream, but she had it compounded where everything was being put into one cream. And basically she was slathering herself in progesterone. Okay, well, so I know enough. I know enough to send up a red flag and then go, okay, I defer to professionals like yourself, right? But that was a red flag to me. It's like, okay, well, progesterone in layman's terms is kind of this nesting hormone, right? Mm-hmm. So why do we want a 58-year-old woman who has 48% body fat nesting? Probably not such a good idea.
We don't.
Right.
Not usually. Yeah, that's a tough one. She, in all likelihood, she probably needed a little different avenue for hormones for that. Mm-hmm. And the hard part is with testing, too, is knowing what you're looking at, when you're looking at it, like how you're looking at it. It's more than just, oh, this level's low. Well, is this level low because we're at day 3 in our cycle, or day 17 in our cycle, or day 29 in our cycle? Like, where are we at? What's going on? Are we cycling? Are we not cycling? If we're not cycling, okay, then what are we looking at here? Why are these levels the way they are? There's another step of looking at things, and just being aware that there's another step is sometimes all it takes for someone to go, oh, I didn't know that. Let me learn more. So, yeah, that's
which comes down to just basic interpretation, right? Of like, okay, what do these labs mean? Mm-hmm. What do these levels mean? Mm-hmm. They always say like, well, my level is normal. I'm like, well, how do you know what's normal?
No, normal is a broad level.
Normal and compared to what? Right?
And most patients don't realize, women especially, that when they look at their level, like it says in there, which phase are you in your cycle, and it gives different ranges. Right. And some of these ranges overlap a little bit. Like, what does that mean? And what does the graph look like? And like, if we graph this out, what would we do? And what would that tell us? And like, it gets deep quickly. And I also see why a lot of doctors don't want to do this stuff, because it becomes a thing quickly.
Yep.
And frankly, women can really feel bad quickly if they're doing the wrong thing at the wrong time.
Mm-hmm. Yeah, which is exactly her case. It was really unfortunate, right? Yep. So then she couldn't figure out, well, I lost 40 pounds doing the keto diet, which I'm like, great. I'm a big fan of like, okay, what worked once may not necessarily work again. It may have been the keto diet that was successful because she just stopped eating Ritz crackers, right?
Right.
Like all day long. I mean, we don't know it was keto,
right?
It was like keto probably eliminated a lot of things.
A lot of bad foods.
Exactly, right? Mm-hmm. Okay, cool. Well, so the bottom line is people have to find a quality provider.
Yeah,
right?
They've got to go somewhere, and that's hard. That is not an easy thing to do.
But you guys work with people remotely.
We do work with people remotely. We work with people all over because we've helped people find quality people in their area. Mm-hmm. We've actually taken care of people at distance just because they don't trust someone else, or they've had a bad experience at the place that is local to them, and so they want a different set of eyes. So yeah, we help people wherever they are.
I come here from Idaho.
Yeah, you come here from Idaho. We have
it's not just because I like hanging out with you.
I know.
I mean, that's kind of a part of it.
and that's we're very grateful for that too. And I impress upon our staff, like, look, we have people that fly over thousands of providers to come to our office. They're doing that for a reason. And so, when I tell that to other patients that, we see at distance or whatever, I'm like, you can come here, you don't have to stay where you are. You can come here. Mm-hmm. And for some they do, and for others they don't. Mm-hmm. And it makes no difference to us. Our job is to help people in the capacity that they want to be helped, mm-hmm. as long as they're wanting to be the helped.
Totally. Well, and that's why I even mention it, right?
Right.
It was like, because I think a lot of people just don't think that way,
right?
Like, look, at the world is open to you. You pretty much can, get places very quickly now. Mm-hmm. And if you can't actually physically get there, you can get there through your computer very easily.
Right.
But people just need to broaden their perception and like, okay, what are they willing to do for their health? Because for me, it was a matter of, okay, how much do I really need to work through the stuff that I was facing with hormone issues and all the other stuff.
Yep.
It was like, well, it's number one priority to me.
Right.
And so people do have to figure out whether or not they really want to be helped.
And they have to ask themselves, well, what is possible? Mm-hmm. If you start asking the question, what is possible, things present to you or present to them in a different way. Yep. So what is possible?
It's possible to feel super good.
It is. It absolutely is.
Like,
it's possible to be amazing.
I feel like better and better every day I get older.
Yay. That's perfect. That's how we're supposed to age. We're supposed to age feeling good. We're not supposed to age falling apart.
No, I just was at, I was just at this really phenomenal place, Castle Hot Springs in Arizona.
Mm-hmm.
It's like this wellness resort. I'm going to have my retreat there, which I want you to come speak at, by the
All
way.
right.
But our Tai Chi teacher said something. He was talking about women, these Chinese women that do Tai Chi, and that like they're like 90 to 100 years old, and that when they're going to die, they literally just bring all their stuff that they use for their class to him and say like, I'm not going to need this anymore. And then literally they don't show up anymore and they're dead. And he said, I know. I was like, wow. And he said, no, they are really that in tune because they have a different perception than we do of death. Mm-hmm. They die in one day. Mm-hmm. We, in this Western culture,
die
view
slowly
dying
over decades.
as like fucking 20, 30-year process.
Mm-hmm.
That has stuck with me. It gives me goosebumps now. It's like, I'm like, I am going to live by that,
mm-hmm.
right? Like, I just want to die one day, right? Mm-hmm. Hopefully that is the case. But this whole concept of accepting that you're just slowly dying and dragging it out and you just start whittling away at who you are with all these just constant health issues and increased number of prescriptions you take and how many times you got to go to the doctor, that's bullshit.
Yep.
That is not dying. That's just like pissing your life away.
Chronic disease is one of the biggest expenditures in healthcare. We pay so much money to take care of chronic disease. 2/3 of the population, I think maybe it's not quite 2/3, but close, 60-ish% of the population has at least one chronic disease,
Jesus.
With 25% at least having 2 or more.
Wow. I didn't know those numbers.
It's insane. And it's something like 86% of healthcare expenditure is on chronic disease. Chronic disease, for the most part, is completely preventable.
Mm-hmm. A vast majority of it is lifestyle related.
Correct.
Right? Mm-hmm. That's why when people say, oh, this is normal, it's kind of like, I don't really like that term because it's like, well, yeah. But when you're living in a society of complete and utter dysfunction.
Right. Sickness is normal in this
like
country.
You said, right? Like people like sickness is the norm.
Yep.
Like you don't want to be normal.
Mm-mm. Yep.
That's powerful. We'll end it there.
Okay.
Thanks.
You're welcome. Thank you for having me.
You bet.